there was a point where she had this cold, you know, it started off as a cold, and it was just escalating, and it just lingered, and it wouldn't go away. And we would take her to the doctor, and the doctor said, well, you know, just give her, you know, this or that, you know, but it wouldn't go away. And she was wheezing a lot, you know. She was struggling to breathe and stuff, and we knew at that point that there was something wrong. My name is Louis Partita. This is Valerie Partita.
And these are our puzzles.
And that one right there.
This is Ava.
That's Eva. And
She has cystic fibrosis. She's gonna be 4. And that is her sister Nina. And Nina is a carrier. And she's 2.
Ava is a very bubbly, friendly little girl. You walk in the room and she wants to hand you stickers, and very full of energy, and definitely has that toddler in her right now.
Ava was diagnosed at 8 months of age, and at the time she was diagnosed, she was quite underweight for her age, which is a consequence often of symptomatic diagnosis of CF in infancy.
it always seemed like she never was satisfied with her food, you know what I mean? She would eat, and then
Very picky.
Didn't want the food, you know. Couldn't, you know, we really struggled to try to, you know, we tried everything, and it was getting real frustrating, you know. It's like, are we doing something right? Does she like our food, you know? What is it, you know? Is it the baby food we're giving? You know, you just don't know.
She came to our center when she was 8 months old and newly diagnosed, and with her weight and height both below the 5th percentile. And we had really hoped that with getting her on enzymes and optimizing her enzyme dose, using fortified formula and other strategies to help the family, that she would make really great strides with her nutrition. And after a lot of work on the part of our team and her family, we just weren't seeing those gains that we had anticipated.
It has long been known that people with cystic fibrosis who achieve normal growth have better lung health and a longer life expectancy than people who do not gain weight well and who do not attain the height that we would predict for their family.
I mean, you beat yourself up, you know what I mean? Because you think it's your fault, you know?
And you're not eating, and you're restless.
And you're stressed
You literally
out,
cannot let them do it on their own. You literally are there for like an hour, sometimes an hour and a half, just trying to get something in them, like, I don't want to say force feeding, but that's practically what it came down to.
Getting a toddler to eat more than they have an appetite for is a huge challenge. They don't understand the concept of needing to eat more past what their hunger says they would like to have.
And although on average toddlers will take in what they need, we know that it often does not happen in cystic fibrosis.
For me, it was like, I saw her not gaining weight, you know, and she needed some kind of help.
So at 17 months old, G-Tube was introduced to the family.
When I was first introduced to it, and, you know, they told us about it, I was like, there's no way I'm going to have my kid on a, you know, on a machine feeding her at night, you know, no way, you know. It's not going to happen.
We went home and talked about it. To be honest, we were not for the G-tube at all. We were going to try and stretch it out as long as we can. It's just the thought of an object in her belly and being maybe a scar if it ever comes out. It's just, you don't want that for your 1-year-old.
There are a couple of common reactions when you first introduce the concept of tube feeding. One is that the patient and or family feels like they've failed somehow, that, you know, gosh, I'm doing all these things to try to get my weight up and it just didn't happen. What did I do wrong? And the fact of the matter is that for most people, you didn't do anything wrong.
We thought we failed, you know. It was like, no, we can do this, you know.
Right,
So you anticipate those growth charts. I was like, let me see the growth chart and, you know, make sure she's gaining some weight. Maybe we'll need the G-tube, you know. But, you know, it wasn't happening, you know.
We do have a lot of families and patients who worry that they're going to become dependent on the calories that they're getting from the G-tube feeding. That typically is in situations where a child might have a food aversion and really aren't able to take that many calories by mouth to begin with. However, for most people, their appetite's increased, they have more energy, they're really using the G-tube as a surplus to what they're eating during the day, not as a replacement, which is exactly what we encourage them to do.
I didn't know if it was going to bring some kind of eating disorder for her, you know, she's going to turn away food, you know, she's just going to be dependent on this G-tube, you know. And so that's what I was skeptic about, you know. But then I started thinking, you know what, I think those are just my thoughts, you know. I'm being selfish, you know. I'm being selfish, you know. I got to start thinking about what she wants, what's good for her. What about Ava, you know? And I think that's when I decided that, yeah, I'm gonna go ahead and let them go ahead and put the tube in her and see how it goes.
Her gastrostomy tube was placed at 18 months of age in order to assure that she got enough calories in to achieve good growth and to promote good pulmonary function.
The day of it, she was an angel. It was probably one of the worst days for me emotionally of my life, but it was fast. It was less than an hour. We got to go in right after. She wasn't comfortable. She was bandaged up for about a week or so. It was like any surgery. It looked like she was in some pain, but she took to it real fast. And I was probably a wreck the first couple weeks. Like, I wish a nurse could have lived with me for 2 weeks and just made sure everything, but we handled it great.
She's made really great strides with her weight. Her height was a little bit slower to follow, but by 24 months, she was within her genetic potential for height as well. And she continues to make really great strides with her weight.
That growth chart, I mean, it was going like this, you know, down. As soon as she got the G-tube, it spiked right up. She got in the 20 percentile, then there was the 30 percentile, then there was the 40 percentile, and I think right now she's past the 50 percentile. You know.
She gets like about, I want to say 900, almost
close to 1,000 calories
a
at night. Yeah. One thing is that, you know, since she's on the G-tube at night, you know, she really doesn't eat breakfast, you know what I mean? But lunch is a little better, you know, quite a bit better actually, and dinner. Dinner,
it's like a couple dinners.
Yeah, she'll eat at dinner. It's not like it used to be, like, you know, when we were trying to force her. Now she's actually enjoying food. But to tell you the truth, for her complaining about her button, it's very rare. Very rare. I mean, it's almost like she's had it all her life, you know what I mean? So she really, it's a part of her now, you know. And all it looks like is, I don't know, this is what I compare it to. It's like you know, that thing you blow up when you're blowing up like a, you know, a floaty or whatever. That's basically what it looks like, you know. So it's not like this, you know, real ugly thing sticking out of her stomach. I mean, it's
a part of her.
Oftentimes, once people have started using tube feeding and are starting to feel the benefits of their increased weight, typically they'll have fewer hospital admissions. They'll talk about how they used to be admitted on a regular basis, and now they might come in one time a year, or they haven't been in a few years. So we hear that a lot.
Ever since she's been gaining weight, I've seen that that she hasn't gotten sick, you know. And if she does get sick, she fights it on her own. Before, she was going to the hospital all the time, you know, doctors, you know, always constantly going, you know, all the time. As soon as she got her G-tube, she hasn't been to the hospital at all, you know. And I mean, that right there alone, you know, that right there alone is enough for me to, you know, to be a big time believer.
Before, while she was younger, it had come up open a couple times, and she did have a couple soaked mattresses. We try not to like wake her up or razzle her, and try to just switch the bed, put her back to bed, and start all over again. There were a couple times she did get tangled up in the tube while she was younger, but she's really good now. There have been a couple times in the middle of the night she'll go, "Mommy, my button came up," and I'll go in and I'll put it on, but it just gets better with time.
You know, kids go swimming, they play their sports, they do all of their normal activities. Kids live completely normal lives with the G-tube.
I almost forget it's there, because she's backbends, cartwheels, flying on the couch. I mean, you just forget it's there, because if it doesn't bother her, it's not gonna bother you. Or don't do that, sit down, watch your button, you know, you don't want to be like that. If your child's not gaining weight, I mean, I wouldn't dilly-dally around it. I mean, this is a life. This is your child, you know. You want what's best for your child. You want your child to have a chance. I'm not saying it's always the best option, but it was for us. It was for Ava.
Yeah. I mean, she's a kid, you know. She's finally enjoying her, to be a kid.